Hi everyone, I'm Dr. Sarah Kruis. Thank you for coming. I have been a chiropractor here for almost 4 years. I knew I wanted to get into healthcare and I knew I wanted to do something natural. And my dad's a chiropractor and I was like, that sounds a lot like what he does. And so once I started considering it, then I really fell in love with it and here we are. So tonight we're going to talk about chiropractic for infants and children, which is one of my favorite groups of patients to take care of. But before we get into that, we need to go over some basics. So if we understand the chiropractic basics, then we can understand how it applies then to kids. So a chiropractor is a doctor that specializes in the health and function of the spine and the nervous system. So you can see kind of in this picture, so our brain is up, in our head, and then our spinal cord goes down our back. So that's our central nervous system. And then we have nerves that go out from there then to our body to control all of our function. But our spine, thank you. So our spine are almost like a suit of armor that's protecting that central nervous system. So we've got our spinal cord running down our back here, and then all those nerves branching off then going out to our body to control function. So our nervous system is one big interconnected highway, or information highway. So we always are having these signals from our body, or from our brain out to our body, and then body back to our brain. And not only is that our brain telling things how to work in our body, telling our stomach to digest and telling our foot to move, but it's also that feedback of all of our sensory organs, like hearing, smelling, taste, but also anything going in our body, telling our brain what's going on in our body and in our environment, and really forming that perception of the world around us. So anyway, all of this is going on in your nervous system, and your spine has, like I said, is like a suit of armor protecting that nervous system. So what we are looking for as chiropractors is what's called a subluxation. So a subluxation is when we have a misalignment in one of those joints or vertebral segments in the spine, or dysfunctional movement, and that ultimately affects the nervous system function, and then therefore is going to affect how well our nervous system and our body are talking to each other. So our main goal as chiropractors is to detect and correct those subluxations so that then our body can function to the best of its ability. So that doesn't just apply to someone that comes in with back pain, for example, which is probably the most common thing we see with a new patient, is someone is coming in with some sort of pain. But it's also going to apply to anyone, really. So whether you have pain or not, no matter what age you are, we all have a nervous system and spine that needs to be in tip-top shape. So go through one more thing and then we'll talk about the first trauma. So those subluxations are caused by 3 things. So thoughts, traumas, and toxins. So thoughts would be our mental, emotional state. So stress is the biggest one we think of. Toxins would be anything that we're putting in and on our body. So environmental toxins, or what kind of food you're choosing to eat, what kind of drinks you're choosing to drink, that's all going to affect our body. And then traumas is not just a big trauma like a car accident, but it's also the little traumas. So our posture, or if we cross our legs every day, or if we sleep on our stomach and crank our head to the side every night, those are the little traumas that are going to add up. So the first trauma that we all experience is birth. It's also physically traumatic for the mom, it's a lot, but it's a physical trauma to the baby as well, no matter what kind of birth it is, no matter if it's a natural vaginal birth or if we have other interventions as well. So with the most natural birth, there's still a lot of pressure being put on their spine. Not only in utero, they're really cramped in there, but just during the delivery, there's a lot of pressure on their spine that can cause those subluxations and cause that interference with the nervous system. But then if we have You know, any intervention needed like forceps or vacuum to help get the baby out, that's a lot more tension on their spine and pulling on their head and in their neck especially. Even an epidural is going to add a lot of stress to the baby, physically, but also chemically. So an epidural is going to decrease the mom's ability to release oxytocin, stress hormones, endorphins, and I forget what it's called, but it's a kind of prostaglandin, A2 alpha, I think, or F2 alpha. So all of those hormones are working together to help with labor. So if we're decreasing those hormones, then we can have a prolonged labor and have a higher need of other interventions like the forceps, the vacuum, the C-section. But also with something like the endorphins and the oxytocin, or more so the endorphins, like those natural painkiller hormones that mom is getting, she's not getting as much of them, so then neither is baby. So it's just a lot more stress on their body. And another thing that can cause subluxation. So, and then C-section is also a slightly more traumatic birth, just because there's a lot of tension again on their neck, especially pulling them out. So, so all of these, any type of birth, like I said, is a good reason to check a baby's spine, and to make sure then that we can take care of those subluxations right away. So it's important to adjust babies right away, but also it's important to adjust moms during pregnancy. So chiropractic care during pregnancy is not only going to help with that nervous system function and control, we'll focus especially on the pelvis and sacrum, and there's a lot of nerves that go out then to control reproductive system organs, but then also just that physical alignment of the pelvis, and we can work on like the round ligaments and make sure that everything is in alignment and moving freely, and that will help baby to find the best position possible for delivery, but also will help like mom during delivery too, to have a smoother labor and delivery. But also, if baby can find a better position by taking care of the mom, then that's going to help baby during delivery as well, and less trauma to their body as well. But also chiropractic care during pregnancy can help just with those pregnancy-related discomforts, but also postpartum recovery is a big thing. So I typically recommend my patients to come in 1 to 2 times postpartum, just depending on how they're doing, to make sure everything is healing in the right position. And then we just go back into wellness care from there. But yeah, babies can be adjusted from day one. So like I said, all those reasons with birth and whatnot to adjust them from the get-go, then we're able to make sure their spine is in alignment and their nervous system is functioning as well as possible, so that their body doesn't have to develop around that interference from the beginning. They're able to have the best possible start. But Dr. Kruis, is it safe? Yes, it is very safe to adjust a baby. The amount of pressure that I use to adjust a baby is a little more than it takes to blanch your fingernail, or maybe like the amount of pressure it would take to check the ripeness of an avocado. So it's not like a quick thrust kind of adjustment like we do with an adult. It's very low force. It's more of like a sustained contact, waiting for that bone then to adjust into place. So it's very gentle. Most babies just lay there and look up at you and smile, or some of them sleep through it. And then for toddlers, we use what's called an activator. So that is, I was gonna grab one. Do you have one? Look at that, perfect, thank you. So we use what's called an activator. So this is an adjusting technique that is also very low force. So it makes a little click. So when you talk about the physics of the adjustment, if you have more speed, then you don't need as much force. So this is a very fast thrust, or very fast force, and it's a very localized spot. So it's going to be a very gentle adjustment. And I even do it through my finger to diffuse it a little more. So the reason why we use this for toddlers is they're not just gonna lay there and look at you while they're being adjusted. They're gonna be a little wiggly. So we just work with it and do what they are most comfortable with, and adjust them that way typically. And the other doctors might do it differently, but that's usually how I approach it. Let's see. So I'm going to go through some common things that we see with babies, and then we'll go through some common things that we might see with older kids, and then we'll go through a study about colic. So common issues that I see with babies, ear infections, not just babies, but older kids too. Babies or anyone is born with their inner ear tube is more horizontal, and then as we grow, it becomes more vertical. So already they are more prone to things not draining well. But then we have a lot of nervous system control from our neck goes up to our inner ear and goes into like those muscles around our ear too. So if we're subluxated in our neck, that's going to affect, make muscles more tight, and it's going to affect function and affect that ability for our ears to drain. But also the adjustment has a big impact on our immune system. So we have that double whammy of boosting the immune system, but also helping with drainage for ear infections. And often we can avoid getting tubes with kids. So that's exciting. It's going to help with fussiness and colic because we're going to have less of that irritation and interference on our nervous system. With a subluxation, we can also get like muscle tension, and obviously, you know, it's more noticeable with an adult, but you can have discomfort and with a subluxation as well. And sometimes that can lead to colic, or just the dysregulation of the nervous system can cause or contribute to the fussiness. So that's why we can help with that. Digestion, gas, constipation, all that kind of stuff, just from better nervous system function, especially from our lower back, is going to control a lot of those functions. But also from our neck. There's a lot of control that goes down into all of these organs from the top of our neck. So that will help with those functions. Latching has, so chiropractic has a big impact on latching because we need proper motion and nervous system from the jaw and our neck. So if we can adjust the neck and help those nerves to work better, baby's able to move their jaw better and be more comfortable too, and latch better. It's kind of same thing with tension or torticollis. So I mentioned typically like it's the subluxation that happens first, and then we can get muscle tension on top of that. Or in a more traumatic birth, they could even get like a muscle sprain or muscle strain. And that can lead to more of a spasm, and like a torticollis is where they're like stuck like this. Or it could just be like a side preference where baby's just tighter on one side. So by relieving the subluxation, then those muscles can calm down and that spasm can heal. We can help babies sleep better. One of the two most common side effects that I warn my parents about after first adjustment is they're either going to sleep really well or they're going to have a big poop. So I've had many babies fill their diapers either as I'm adjusting them or right after. And then also it's going to help with milestones and reflexes and just development in general if our nervous system is working better. So, and there's many other benefits, but these are what I probably see the most. I have a lot of babies that come in for wellness too that don't have an issue, but these are maybe issues that could present. And then common issues with older kids. So kind of like in line with the colic and fussiness, we can have behavioral issues or issues like regulating, like emotionally. So if we're able to have a more balanced nervous system through the adjustment, then that's going to help with both of those. Kind of that goes in the same line with like focus and like performing in school. With a more balanced nervous system, they're going to be able to focus more. And then sports. So after a chiropractic adjustment, we have better muscle coordination. And so that will not only help with like sports performance, but also like after a sport when we need recovery help, or maybe they cause subluxations by a sports injury or something, we can help stay on top of that. Again, immune system is benefited from an adjustment as well. And then bedwetting is something that we see as well. So that typically the type of bedwetting that chiropractic will help with is when we have a disconnect between our brain and bladder. So the bladder fills up at night, but it doesn't signal back to the brain to wake up. And so then they wet the bed. So if we can restore that connection, that proper communication through the adjustment, then we're going to help a lot with bedwetting. Okay, and again, there's many other benefits, but those are the biggest ones. And then we're going to go through this specific study about colic. So this was done in 2007, so in the UK. So in general, about 10 to 30% of babies suffer from colic. So that would be unexplained fussiness or excessive crying in an otherwise healthy baby. And it's really just like I don't know, like too bad, like your baby is fussy, you know, which is such a terrible answer. But so they took 104 babies. They were all 8 weeks old and younger. And this was in 2007 or between 2007 and 2009. And this was done at a chiropractic teaching clinic. So it was students that had like learned enough and practiced enough that they were seeing not just other students. And so they randomized these babies into 3 groups. So one group was these babies were being adjusted and their parents knew that the babies were being adjusted. And then the second group was the babies were being adjusted and the parents didn't know whether they were being adjusted or getting the control. And then the third group were not getting adjusted and the parents didn't know if they were getting control or getting adjusted. So they were adjusted for 10 days or over a 10-day period. They were adjusted, like examined and adjusted where they needed it, when they needed it. And then parents like kept track every day of like how many hours they cried and any other changes that they noticed. So over this 10-day period, the babies that received chiropractic care saw a decrease of up to 3 hours of crying. So up to 3 hours less of crying, which is huge if you're a parent in that situation. That's a big difference. The average was 2 hours less per day. And then the babies that didn't get adjusted and got the control treatment, they saw like an hour or less reduction. So there's still a little bit of reduction, but significantly more for the babies that were adjusted. And it was interesting that the 2 groups where the parents knew versus the parents didn't know, there was no difference. Like the babies recovered in both scenarios, which means like there's no parent placebo. And there really is no placebo in babies in general, because they don't have this preconceived notion of like, I'm gonna feel better after this. Like they don't think that way yet. So just in general, that is a really cool part about taking care of kids is they just get better because it just works and they don't have a placebo effect with it. So kind of to put it into a different, phrase it a different way, excessively crying babies were at least 5 times as likely to cry significantly less if they received chiropractic care compared to not receiving chiropractic care. And these were just chiropractic students. So, I mean, I was not super great at adjusting when I was a student, you know, so imagine if these babies were seeing like experienced doctors and seen for longer than 10 days too. Just the even more of an impact that would have. So it's very exciting stuff. So again, thank you for coming. If you are interested in hearing more about chiropractic for babies or interested in having your baby or your kiddo looked at, the best thing to do would be to call the clinic. We're at Natural Health Family Chiropractic, of course, and I'd love to meet you and take a look at them.